us. It's still the conversation, and on the segment, you know how we do it. We talk about everything and anything that has to do with Lagos. This morning on this segment, we'll be talking about something quite timely, something quite interesting, and as a mother, it is something that is common, you know, with mothers and even men and fathers. I used to ask one question when I was much younger, that there's this mark on my arm, you know. I grew to notice it as a child, and my mom told me that, yeah, it's called BCG mark or something, which is as a result of being immunized as a child. This morning, we're looking at Immunization Week 2026 with a theme for every generation, vaccines work. Yes, we'll be trying to understand that theme and many more that has to do with the Immunization Week 2026. And we have with us this morning four very, very, very important guests. I'll start with Christiana Adeboboye. She's the Director of Nursing Services, Lagos State Primary Healthcare Board. We also have Olusola Hassan, Chairman, Advocacy Committee, Lagos State Accountability Mechanism for Maternal and Child Health. We also have Dr. Michael Adebayo Adeniji. He's the Assistant Immunization Program Coordinator, Lagos State Primary Healthcare Board. And last but not the least, Dr. Ayodele Renner. I like his AKA, the noisy Niger pediatrician. Is a pediatrician and health content creator. You're all welcome. It's a full house. You're all welcome.
Thank you very much. Thank you for having us.
Okay, let's all set the pace this morning. Immunization has been around for decades. At least I'm over 50. So I understand what immunization is all about. But why are we talking about it intentionally as that today? Dr. Adeniji, that's a question for you.
Thank you very much, Ma. Thank you for having us. Immunization generally becomes something that the world decides should be a focus, usually during this period in the month of April, so that the world is brought into focus that immunization, which serves as the bedrock of health in the society, the bedrock of development, if you permit me to say. Because like we say, it's only healthy people that can talk about developing a nation. And immunization, which serves as a bedrock that protects people, that protects individuals, that makes up the society, the community, needs to be focused upon and needs to be discussed more to ensure that we have a viable society. So this year we are talking about immunization for everybody, everyone from cradle to grave, if you permit me to use that word, to grave, yes.
Okay. Not just for children.
And yes, it's not just for children. Are involved, or can participate in immunization, because immunization, like we said, is the protector, the shield for each and every one of us. In other climes, you have them have what we call, during some season, you hear them talking about flu shot for their elderly, flu shot for young ones, so as to protect them. So immunization is not just basically for children alone, but from birth till the grave. You have the opportunity to always ensure you are protected against infections, against diseases, bacterial, viral, whichever form. You are protected whenever you are immunized against this thing. So that's the reason why we are bringing it into focus again, to bring it to the notice of the world again, as it has been agreed by the World Health Organization and other international bodies, that this week discuss about immunization. Let everybody know that immunization is still the cornerstone of our health. Let them know that for them to be protected, for them to live an healthy life, they need to be immunized. So that's why we are bringing it again, that immunization for us is for everybody. Don't think it is just for the children, and after some time, everybody do not need immunization again.
Okay, thanks for that clarification, because I never knew that it was also for adults. So even if you had missed it as a child,
you can always
catch up with it. So how has been Nigerians' response to immunization so far, since you've been coordinating the exercise?
Immunization, generally in Nigeria, and coning it down to also Lagos State, has been on a steady progress, if I will be permitted to use that word. The last data we have from the Nigeria Demographic Health Survey that was released, we discovered that our immunization data is showing increase in utilization, in number of people that are getting vaccinated and protecting the society. Nigeria generally has a principle, which Lagos State is the bedrock of, is that we are not going to leave anyone behind. We are going to ensure that as much as possible, everyone that needs to be vaccinated is vaccinated. Every child that is available, every teenager, every adult, every elderly that needs to be protected in one form or the other, especially through vaccination, is captured and being vaccinated. Lagos State, for example, has been doing amazingly well. When you look at those data, and in Nigeria generally, you look at it and discover that there's a reason why Lagos is called the Center of Excellence. We are actually doing good and very well when it comes to immunization activities. However, that does not mean we are where we want to be yet, but there's a steady progression, there's a steady increase in our coverage, there's a steady increase in the number of people that are accepting vaccination because they've seen the importance and know that this is one of the things that can reduce death, reduce mortality, and improve the health of everyone around us.
Okay, thank you very much. I'm sure you're wondering, is Joy still here? Over to you, Joy.
I'm over here. Thank you, Adeboboye. Okay, Dr. Renner, let me come to you now. You are the noisy Niger pediatrician. And so, what are some of the vaccine-relatable diseases that you have encountered, even with the level of awareness that we have in 2026?
So, vaccine-preventable diseases, Joy, are still very much here amongst us, particularly, of course, amongst children. One important one is pneumonia, and of course we know that the biggest killer of children under the age of 5 years globally, including Nigeria, is pneumonia. And the pneumococcal vaccine, which exists to prevent pneumonia caused by bacterium called Staphylococcus pneumoniae, is available, but we still see it quite commonly, and so that of course is a cause of concern. Measles has not left us. Measles is still heavily with us. Measles is not a mild illness, which is why we roll out the measles rubella vaccine with an active campaign, that I was fortunate to be part of. Because measles still have its changes. Meningitis as well, we still see that quite a lot, and even tuberculosis. So all these vaccine-preventable diseases are still with us, and what we do is that once we see those conditions, we actually make a report to our disease notification and surveillance officer, so that they can know that, okay, we have seen this condition here, why is that the case? Is there an outbreak? Are there other children living in the area that have gotten this particular condition? Make sure that it is not an epidemic, So they are still very much here with us.
Let me come to you, Christiana. You are a nurse, and nurses are often the first point of contact for immunization. And one of the issues that we still have facing us is a case of hesitancy. What are you doing to ensure that people are, open, mothers especially, are open to taking vaccines for their children? As a first time, on my own experience, the first time I took my baby, 6 weeks, for immunization, and the way the nurse yelled at me, carry him well. I didn't know how to carry him, and so I felt somehow, but again, I just brushed it off. So for nurses, I'd like you to talk about that.
All right, thank you very much for having me. And honestly, nurses are the first phase when it comes to healthcare, particularly immunization. And most times we have, different sphere to hit, as in what seems good to you may not be good to me. But however, nurses do welcome clients warmly, smartly, and professionally, and of course communicate effectively, and of course we have to make sure that that patient is confident in you by providing your professional touch, your professional skill, and then you talk to them, you communicate to them about what the immunization is. You give the 6 key messages, and before you can give that 6 key messages, you must of course welcome them warmly. Because for someone to just come to me and I say, sit down there, your baby is going to take this, going to take that, of course you will say, what's a trash? So it means that warm welcome, that greeting, making them comfortable and confident in you matters a lot, and that opens the floor for communication and then discussion and then caregiving.
Okay. Okay. Now for Olusola, Hassan, vaccine hesitancy remains a concern in Lagos and Nigeria as a whole. Why is this so? What are some of the stories or the needs you have heard that Nigerians or the Lagosians are always hesitant to receive vaccines?
Thank you very much for that question. A lot of Nigerians in Lagos, they feel that the space at which they give vaccination is too close.
Okay.
Especially, we have some booster doses of immunization, like the OPV and all that. So they feel that sometimes the immunization causes infertility, and sometimes they feel that it causes autism, and most of the time they don't know that a lot of trials have gone into the production of the vaccines. So, because the government cannot just bring out vaccines without trials, without making sure that it is safe and potent for the people. So, with all this, the Lagos State, in collaboration with the community people, they go out, to debunk the myths and then the concerns about people, so that vaccination can be accepted by the people.
So what type of advocacy do you really embark on, and which areas? Is it the underserved areas alone you go to, or you also go to urban places in Lagos?
Everywhere.
Okay.
Everywhere. And then we work with the community people, because the community people, the opinion leaders, the buyers, they have to be able to accept what we are bringing to them. They have to have trust in what we are bringing to them. So most of the time, they are always, being called separately to advocate to them, to tell them that the importance of immunization, to tell them that these vaccines are safe, to tell them the potency of so that they can always go into the community, to talk to the people, to debunk rumors, to tell them, to be able to allay their fears, and then make sure that sometimes they go from house to house. I mean, the stakeholders, the buyers,
they do the house to house
during the immunization.
Advocacy.
Yes, they go from house to house with the mobilizers, so that they can debunk rumors, and then for people to accept immunization. Most times the people that are now refusing immunization is coming down.
It's reducing.
Yes, it's reducing.
But this is for right now. You're talking about immunization for children.
For children.
Children at birth.
Yes.
What about with adults? Is there still resistance, this hesitance, for for vaccination? Because I remember during COVID, some elderly people refused to take it.
But there was a lot of sensitization then. To tell them the importance of the immunization, and then to tell them that a lot of trials have gone into the production of the vaccine. I remember that also, that during COVID we had a lot of resistance to, acceptability. But now, nobody wants to die. The adults too are eager to to accept immunization, So it's really reducing, for people that are not, wanting to accept immunization.
It's reducing. Okay, this next question is for Dr. Adeniji. Since we've talked about it reducing, but we still talk about children. We could call them zero-dose children. What does that mean, and what are we dealing with exactly?
All right. Zero dose initially basically means children that have not taken any vaccine at all. They've not been vaccinated from the point of birth. That is the general.
Were these children giving birth in a hospital?
Oh, well, irrespective
Not all of them,
not all
because
of
I don't know how
them,
you
yes.
escape,
All of them.
you know,
Vaccination
vaccination
from
if you were born in the
hospital.
hospital.
So,
Yes.
It's also one of the things that the state is looking at, because children that are given birth, irrespective of wherever is your place of birth or the condition of birth, we expect that it is still our responsibility to protect that child, irrespective. So these zero-dose children, we are currently finding them a lot in some underserved area, hard-to-reach area, riverine areas. These are some of the communities around us. And aside from that, zero-dose children, like we said, are children that have not been vaccinated. We still have some issues around some cultural beliefs. We have some migrants from other countries, from other states that believe their culture does not allow them or permit them to get vaccinated in any form. So it's still some of the things that we are mitigating against. We are increasing our sensitization, educating the populace, advocating with their stakeholders, their leaders within the community to try and change the perspective and the narrative around vaccination to these people, so as to ensure that these zero-dose children, these children that have not received any form of protection, let me put it, if I say vaccination or immunization, it might be looking, all these children that have not been protected in any form are reached and are captured in our routine immunization services. So this zero-dose children in our community has become a challenge for us. We are seeing it as equity gap, irrespective of whatever place you are giving birth to. It should not stop you from getting the required protection, the required vaccination that you need. So because of that, we are moving into the communities. We are sending our health workers into the community. We have people that we are working with that also help advocate, sensitize the communities to ensure that wherever these children are, wherever we are having migrant communities, wherever we are having informal populations, wherever we are having places that do not even have maybe a primary health care centers around them, there is a service that is designated to this area to ensure that every child, every person within that area that needs to be captured, that needs to be vaccinated, are immunized appropriately.
Okay.
Right
Joy,
now-
okay. Maybe it's a question I want to ask if you want to ask. Okay, go ahead.
I'm writing on Adebayo's question,
Okay.
asking if these children were given birth to in the hospitals. You know, some could start and then not go back to
finish.
collect the other vaccines. So I'd like you to speak on the risks of delaying
Fantastic,
or
yeah.
not even taking these vaccines
Yeah.
at all, especially for the zero-dose children.
Yes. So I mean, Dr. Adeniji has put it quite succinctly, because the reality is that in Nigeria, majority of births take place at home. At home. As a matter of fact, the statistics suggest that 70% of Nigerian children are born in their parlor. So yes, so no, the entry into the healthcare system through antenatal clinics is such an important way in which children, mothers and their babies are introduced to the healthcare system, whereby they can now say, okay, these are the things we expect you to do after you give birth. Now, for those who give birth in the healthcare system, yes, they can get lost to follow up, sometimes because distance from the primary healthcare center is far, which is why going into the community is very important. But to the meat of the matter, really, as to why or what are the risks of delaying or spacing vaccines out too much. Number one is that it leaves children vulnerable. Usually we give multiple doses of vaccines because the first or the only one dose does not offer 100% protection. It offers maybe just a slight percentage of the protection that is required. By the third dose, that is when full protection is offered. What if a parent delays giving that second dose, and between when they get the first dose and when they get the next dose that they've delayed, the baby is exposed to measles or exposed to whooping cough or exposed to the organism that causes meningitis? If that child ends up not dying, they can have deafness, they can have blindness, they can have brain damage that will render them dependent on their families for the rest of their lives. So, if not death, disability will happen. And the reality is that they also manage to put other children in the community in danger. If they end up getting measles and they go to school, measles becomes contagious even before the rash comes out. They can give it to 10 other children who might not have been vaccinated in their school or in their gathering or wherever it is that other children are gathered. So it puts not only the child at risk, but other children in the community at risk. So we always see that there's also no real health benefit to spacing out vaccines, because some parents think that, oh, if the vaccines, you know, as Olusola was saying, that if the vaccines are too close together, they are worried. But there's no real benefit of spacing them out, because it doesn't offer as much protection as it should, and there is no real health risk of the schedule as it is presently in terms of the spacing. The spacing is designed to make sure that the children have the exact dose and the exact frequency that is required for optimal building of the immunity against that disease.
And it's very important to keep to the time.
To the timing.
Yes.
Okay.
I have a follow-up to what he has just talked about. You can watch me on the screen, Dr. Renner. Okay. Do these children, you know, who are already exposed to these diseases, I don't know what to call them, or to these illnesses, is there a remedy, as in when they are eventually cured, can they still now start the immunization process?
Yes. So that's a very important question. Now, there are some diseases that when a patient acquires it, it gives them lifelong immunity. Okay. For instance, measles gives lifelong immunity. But even if they catch the disease, we still vaccinate them. We still vaccinate them because the vaccinations usually come as a pair. So for instance, measles, rubella is a pair. And so that is what we're administering now in Nigeria. And so we're phasing out the measles alone. And so that rubella is still important for us to give the child so that they are protected from getting rubella, which can cause illnesses in the unborn baby like blindness and heart conditions. So even when a child has the disease, we still actually go ahead and vaccinate because number one, it's not harmful. Number two, it's still an extra layer of protection. And number three, because vaccines come in combinations, they not only get the vaccine for the disease that they've had, they get other things as well. Yes, because we are trying to reduce the number of jabs that we're getting. Imagine if we had to give measles and rubella and mumps as 3 separate injections. We would, and of course, the mother is crying, the baby is crying, the doctor is crying, and so
Did you say the doctor is crying? Okay, let me come to you now, because talking about that giving discomfort and pain. So I have talked about my own side as a mom. And let's look at it from the lenses of a nurse. What are some of the challenges that nurses are experiencing in the course of their job, especially when it has to do with vaccination?
Okay, thank you very much. A major challenge is that issue of rejection as a vaccine resistance, due to the fact that a lot of misconception and cultural beliefs around immunization does not support the practice. However, it should be debunked by every nurse or every health worker who is in charge of immunization. You should let them know what the benefits of immunizations are. Because, you know, that's cultural setting or cultural, you know, we are Africans, and anything that has to do with culture, we take it with all seriousness. However, those things, they are not evidence-based. They are not things that can be proven by any science. And so it does not work. Like someone said earlier here that I can remember the mark. I too have the mark. And if at all immunization or vaccination is dangerous to health or will kill, I should have died since then. I was a toddler when I had that. And I can still remember that, and it has worked for me, likewise every other person. So we need to do a lot of, you know, debunking the misconception. We need to do a lot of community engagement, a lot of communication, a lot of jingles. The government should participate in that as well as the community people. So when we have this good knowledge of, you know, what vaccines are, why we have to take them, the importance, and you see that a lot of mothers and parents and caregivers, they come up and accept the vaccines. And then we as professionals we need to make it acceptable. Like what you just said, that someone will come to your facility and you say, no, you sit there, you stand here, or you don't know this. No. That is no more acceptable. Nurses are professionals, and they do their work with a lot of ethics.
Okay, thank you. Okay, I have a question for you, Madam Olusola. What's the role of the media in ensuring that people who are still dealing with hesitancy are able to come to see the light that immunization is indeed beneficial for the children?
The media has been doing a lot in propagating immunization, and not even immunization alone, all the health services that are being given out at the health centers. We have social media platforms that are being created, by the youths in the community, and then not even only the youths. We have opinion leaders, the baales that are on social media. We have the Twitter, we have the Facebook, we have the Instagram, where we can pass on information, to the public, concerning immunization and all other services that are being rendered in the primary healthcare centers. So it's they are really doing a lot, to make sure that the populace know what is going on in the various health center and in the community.
Okay. Dr. Adeniji, again, I'm going to stress something which is very important. Are we focusing too much on children when it comes to vaccination and leaving adults behind?
When we look at the national program,
because I don't see any of those people going around and say, "Oh,
looking
adults,
for adults."
Yes, come and take immunization. Yes,
usually, yes. So usually the MPI schedule, like everybody generally knows that, is what we call the basic foundation of protection for everybody. So it actually covers children from birth currently to 9-year-old. So it is expected that for every current adult that we have, let me put it that way, in Nigeria, at one point or the other, you should have been vaccinated with this vaccine.
Okay.
So the other things that we usually protect our adults from, we have vaccines for pregnant women. They get their tetanus, diphtheria vaccines for during pregnancy, although it is encouraged that the moment you are at reproductive age, you can even commence having that vaccine and not wait until you get pregnant before you start taking the vaccine. Like I said, for our, should I call them our teenagers or our young girls, girls 9 years old, we have our HPV vaccine for them. So it's not just focused on people between birth and 1 year old or 2 years old. We have vaccines across different ages. Also for our adults, like you have been saying, we should not forget
especially men. Because again, you talk about teenage girls, talk about pregnant women. What about men?
For our men also, let me put it in general. As early as, not early, as at 2024, we had the general campaign for every citizen across the nation and here in Lagos also, where we have our measles, yellow fever vaccine. So those are the, that we are giving. Those are specific vaccines for adults. Okay. So both male and female are eligible to be vaccinated for this measles and yellow fever. And just the same way for some people that are traveling outside of the country, there will, some countries will still ask you for your yellow fever vaccine, your yellow fever card. So these are still some of the services that we still provide to ensure that people within our communities are protected, and everyone in general is captured, and we ensure that nobody is actually left behind. So from childhood, not just children alone, the reason why the conversation is usually around children is because mothers, the decision is at the hand of the guardian and the parent. So they can't make the decision by themselves. For an adult, you have the information readily at your doorstep, so you can easily decide, oh, I need to go and get this vaccine or not. But for children, it is the parents that usually makes this decision for them. So as such, we try as much as possible to emphasize that as a parent, you should not leave your child out of this benefit. You should ensure that they also get vaccinated and are protected against these vaccine preventable diseases.
I hope you have heard all you men standing in front of me. Joy,
okay. Let's just a final question from me here. Let's talk about adverse effect of these vaccines and of course safety of vaccines.
All right.
For both of you, let's start with Dr. Renner.
Okay. So thank Joy. Vaccines and hesitancy. When it comes to the fear of vaccines, safety and side effects are a very important factor that determines whether a parent will accept the vaccine or not. But we must state it very clearly that vaccines are safe. Vaccines are safe. So everybody says that, oh, what about the side effects? Even paracetamol, as safe as paracetamol is, it has side effects. You can have nausea, you can have vomiting. In some cases, if the dose is too much, you can have liver damage. But with vaccines, they are so safe to the extent that the worst kind of reactions that we usually get will be pain at the site of injection, some kind of fever after the injection has been given, some redness or swelling at the site of the injection. Now, if we are going to have full disclosure, we must say that some vaccines, will react in some people in a peculiar way, such that person A will get the vaccine and be perfectly fine, and person B will get the vaccine and will have an allergic reaction that we call anaphylaxis, which can be quite serious. But you see, this is why usually healthcare workers
when you
are
say quite serious, you mean life-threatening?
Life-threatening, yes,
Life-threatening.
life-threatening. But that happens in fewer than 1 in 1 million doses of the vaccine. Such that by the time you've administered 2 million doses of the vaccine, maybe you won't even see a single case of anaphylaxis. Anaphylaxis can be life-threatening, which is why we always say, you know what, if you get a vaccine and you, if a child gets a vaccine and you feel that the child is acting unusual in any way, then please let your healthcare provider know immediately. But again, those kinds of reactions are so unusual and so rare that one can confidently say that vaccines are safe and vaccines are effective. So the duty of the healthcare professional really is to put information out to say, you know what, vaccines are safe, these are the possible side effects, and this is what needs to be done if you notice any of the side effects.
Just before we go,
Okay.
are vaccines free?
Okay.
Yes.
Advice.
Are they free?
Yes.
Okay. Okay, that's very important because
Okay.
funds is usually an issue here
Free
in Lagos and
in
Nigeria.
government hospitals.
Okay. So let
All
me
right.
just add
Okay,
up
you want
to
to add something?
yes, what he has said. Obviously, vaccination is an evidence-based practice. And so when mothers come, we hold the mother the responsibility to give information, tell the woman about the 6 key messages, telling the woman or the caregiver the name of the vaccination the child is about to take, the site you are giving this immunization, how many times this child will take this vaccine, and then the benefit too. Don't forget, once you tell the woman the benefit of the vaccination, and of course when the child will come back for the next dose, and then you will educate her on AEFI, adverse effect following immunization, that in case your child develop fever or your child have swollen site or redness of the site, get back to us, do this, you give that information, and then the woman will be rest assured that the vaccination is safe to be.
Interesting conversation we've had here in the studio. Vaccines are safe, and
Very
of course, to help prevent vaccine-preventable diseases. Thank you so much for your time on the conversation. Let me start with you, Dr. Ayodele Renner.
Thank you, Joy.
He is a pediatrician and health content creator. Also here with me, Christiana Adeboboye, Director, Nursing Services, Lagos State Primary Healthcare Board. And over there with Adebayo, we have Olusola Hassan. She's the Chairman, Advocacy Committee at Lagos State Accountability Mechanism. And of course, Dr. Michael Adebayo Adeniji, Assistant Immunization Program Coordinator, Lagos State Primary Healthcare Board. Thank you so much for sharing insights on the conversation.
Thank you
We've been
for
talking
having me.
about Immunization Week 2026, and the theme for every generation, vaccine works. The programs continue shortly. Stay with us.
Thank you.